Hello and welcome back to A1C2Z, the ABCs of diabetes. My name is Christina Bowie and I have a video series on YouTube and Facebook all about diabetes and how to manage your diabetes. This video is actually a request from one of my viewers who requested that I make a video about how to check your blood sugars. Let's first talk about how often you should be checking your blood sugars. It's going to vary a lot from person to person, but some general guidelines are the more medications you take that have the potential to lower your blood sugars and cause hypoglycemia, the more often you should check your blood sugars. As well as if you tend to have a lot of low blood sugars, you should check your blood sugars more often as well. Some patients might check their blood sugars 5 or 6 times a day, and other patients might check them every few weeks or a couple times a week. So if you're on mostly oral medications, not including glipizide, glyburide, or glimepiride, those are medications that frequently lower the blood sugar less than 70, which is a concern. Then it should be sufficient for you to check your blood sugars at the most a couple times a week, maybe once while you're fasting and once before bed. That way you keep an eye on them and make sure your blood sugars aren't doing anything crazy. If you take any of the medications I mentioned, in addition to your pills, your other pills, glipizide, glyburide, or glimepiride, then it's probably a good idea to maybe check your blood sugars twice a day, once in the morning and once at bedtime. At least do that a few times a week. If you are on insulin, so if you're only on one insulin shot a day, then you want to check your blood sugar at least twice a day, once in the morning and once at bedtime. If you're on multiple insulin shots a day, more than one, then it's probably a good idea to, at minimum, check your blood sugar before each meal. So before breakfast, that's your fasting sugar, before lunch, before dinner, and at bedtime. That way we have a good idea of what your blood sugars are doing throughout the day. Always keep a log of your blood sugars. That way when you follow up with your provider, whether you see a diabetes specialist or whether you're managed by your primary care doctor, you can show them what your blood sugars are doing and they can adjust your medications according to that. A few things that we need to know before we get started are what is the supplies that we'll need for checking our blood sugars. There's always going to be the same supplies that you need regardless of what brand your meter is. You're going to need a blood sugar meter, you're going to need test strips, you're going to need lancets, and you're going to need either antibacterial soap or alcohol swabs. Does it matter which meter you use? No, it doesn't. Use whichever one your insurance will pay for or that you are able to afford. There's a lot of different things with a meter that can help when picking out which one is right for you. One thing I always tell patients is make sure that you check the cost of the test strips, because the meter you only have to buy it once. The test strips you'll buy on a regular basis. And so you want to make sure that you don't buy a meter with very, very expensive test strips. Sometimes the meters will have a speaking feature, which is good for patients who have difficulty seeing, or sometimes they'll have really big letters, and that's also good for patients who have a hard time seeing. There are continuous glucose meters, which are good for patients who tend to have very low blood sugars and don't always realize when their blood sugars are low. And you can sometimes get those, so it's usually a patch that goes on, and sometimes on the back of the arm, and then it has a little device that you scan, and it tells you your blood sugar, and usually you change out that sensor every 10 or 14 days. So these are also really good for patients who don't like to stick their fingers to get the blood sugar measurements. Okay, so what I have here with me is I have 3 different glucose meters. I've got this very basic meter from CVS, which has the meter, the test strips here, and most of these meters are going to come with a Lancet device, and so you can actually use that in place of the more traditional Lancets, which are like disposable. Then I've got an Accu-Check meter, which has all the same supplies. It's got a meter here and test strips and a Lancet device. It's got some Lancets in here. And this one came with a solution to check the functionality of the meter and make sure that it's accurate. I've already done that. Some of them will come with that and some of them won't. And then I've got a one-touch meter, which has the same. It's got a meter here. It's got test strips, and it's got a Lancet device. So all of them are going to have basically the same things. They're all going to have an on button. They're all going to have a place to insert the test strip. Every meter is going to be slightly different. So if you're not sure how to use the exact meter that you bought, usually the pharmacist can show you how to do it whichever pharmacy you buy it from. But typically they're all going to be pretty similar. I have alcohol swabs here to clean my fingers before I stick myself. And that's to prevent any infection from anytime you're going to stick yourself or break your skin or anything. You want to make sure that the area is clean because you don't want to get an infection, especially having diabetes. Diabetic patients are at higher risk of infections. So I'm going to clean myself with alcohol swabs, but not everybody uses alcohol. It's okay if you wash your hands with antibacterial soap prior to checking your blood sugars. That's just as good. So let's get started. All right, what I'm going to do is I'm going to clean my finger with alcohol really good. And I'm going to let it dry for a few seconds. And then I'm going to go ahead and use one of these Lancets here. But these other Lancets are pretty simple to use. With this one, this is the one-touch Lancet device. So with this one, you twist off the top here. I had already put a needle in it a little bit ago when I was playing with it, so I'm going to take that out. The top it just twists off and on, just like that. We're going to twist it again and pull it off. See, it has a little hollow hollowing there, which is where the needle goes in, and then this part twists off. You can see the needle. It's a little hard to see. Okay. And then this goes right back on, and then you put it against your finger and you press. All right, so I've given that time to dry, so I'm gonna stick my finger. It's best to stick your finger kind of on the side because it doesn't hurt as much, and there's usually plenty of blood flow. There we go. Barely felt that. Always wipe away that first drop of blood because it's contaminated from the alcohol on your skin. I've got some blood here, as you can see. I barely felt that. Okay, I'm going to turn my meter on. I'm starting with the Accu-Check meter. I'm going to turn my meter on. I'm going to hit where it says test. I'm going to say okay. It tells me to insert a strip. So that's what we're going to do. You have to have the right strips for your meter. You can't just use any strips. Okay? And it goes in. It says preparing to test, apply drop. It's telling me exactly what to do. Now I'm going to put it against my blood. It says analyzing, blood sugar 108. Okay? Super easy. Now I'm going to move on to the one-touch meter. I'm going to turn it on. And I'm going to grab the test strips. I just hit the on button. And I'm going to put the test strip inside, and then it shows me a little blood drop, which means that it wants me to apply the blood. I'm going to put it right here next to my finger. It counts down 5, 4, 3, 2, 1, 120. You may notice there's a little bit of discrepancy from one machine to another. They should always be within about 20 points of each other though. It's not a perfect system. The most accurate way to get a blood sugar level is by sending blood to the lab, but we don't obviously have that luxury. So we rely on these, and they're usually pretty accurate. All right, and I haven't used this CVS one in a while, but let me see if I can turn it on, if it still works. Maybe I just need to put the test strip in. Sometimes if you just put the test strip in, it comes on. But it's an old meter. I've had it a long time, so it may not even work anymore. Nope. Well, that's okay. I don't think this one works anymore. But I showed you on 2 meters how to do it, and so they're all going to be pretty similar to that. Let me clear up this blood, and then, you know, if you really feel inclined, you can always put a Band-Aid on, but usually it stops bleeding pretty quickly. Not a big concern. Make sure that when you're done, you throw all your used lancets in like a sharps container. That way nobody gets stuck with them. Because a lot of times they'll just look like this when you're done, especially if you have a lancet device, and you don't want anybody to get stuck on a used lancet for sure. Anyways, so that's basically it. If you have any questions, you can feel free to comment in the comments section or send me a message. Feel free to share these videos with family, friends, patients, healthcare providers, nursing students, anybody who you feel could benefit from the information. If you have any suggestions for other videos, just let me know and I'll see what I can do to make that happen. Thank you so much for watching, and have a good night.